Hey everyone, this is Dr. Linda Alvarez, and I'm the National Secretary Treasurer for CIR and a member of the Presidential Advisory Committee. The Presidential Advisory Committee was established to help engage our entire national membership of resident physicians around the presidential elections. So far, CIR members have participated in numerous activities with presidential candidates. We have sent out a survey, and now you're about to listen to the virtual presidential town hall with policy advisors from Vice President Joe Biden's campaign and Senator Bernie Sanders' campaign. The forum was established by our Presidential Advisory Committee, so you get answers from the candidates on some of the most pressing issues around COVID-19, healthcare, and immigration. We started off the night with Carmel Martin from Vice President Joe Biden's campaign.
Perfect. Thank you, guys. So on the phone now, joining our town hall is Carmel Martin, who is the policy advisor for Vice President Joe Biden's campaign. Carmel, working in that role, we just want to thank you so much for being here and being a part of our virtual town hall tonight. The format in which we're going to do this is we'll give you 3 minutes to introduce yourself, tell us about your role and about some of the core values of the campaign, and then we're going to go into questions from our Presidential Advisory Committee. So off to you, Carmel.
Thank you so much. Can you all hear me okay?
Yeah.
Yes. Great. Thanks so much for doing this and for inviting me to the call. I guess first and foremost, I just wanted to say how much I appreciate all of you. This is a very difficult period of time for our country and really globally as we battle this public health crisis. And I know if the Vice President were here, he would say how much we appreciate the fact that hospital interns, residents, and fellows are at the front lines of this crisis. And and I really, really appreciate what you do, and thank you for what you do. In his speech on Tuesday night, Vice President Biden highlighted the debt that we owe you and called out all of the doctors, nurses, and healthcare workers who are caring for virus victims and their families and going to work to care for us, even outside of the context of the virus. And we know that you're taking risks so that we can be safe, and I really, really appreciate that. I would say, as the Vice President recognized just earlier this week, the people of this country know how to answer the call in a crisis, and they know that now is the time for empathy, decency, and unity. But we also know, and he's recognized, that our healthcare system is at risk. A virus is spreading, and our economy is suffering deeply. Joe Biden laid out a comprehensive response to the public health crisis last week, and I look forward to sharing more about that with you later in the call. But I just wanted to say at the outset that I believe these plans and his thoughtfulness about how to move forward is evidence of what I believe is his unique level of readiness to lead this country through a difficult time like this. But before we get into specifics around healthcare or the response to the public health crisis, I wanted to speak briefly about Vice President Biden's vision for the country and priorities beyond the immediate crisis. As President, Joe Biden has laid out 3 overarching priorities, which include supporting workers and families, addressing urgent challenges, and restoring the soul of our nation. And he's laid out comprehensive plans across the domestic policy and foreign policy landscape, and I'm happy to answer questions about that. But just to give some highlights, he's laid out some top priorities in being sending Congress legislation that will build on Obamacare with a public option to ensure everyone has access to affordable, high-quality health care, sending an immigration reform package to Congress with a roadmap to citizenship for nearly 11 million people. He's expressed his commitment to not just protecting, but growing union membership and supporting American workers. including pushing to enact the PRO Act and the Public Service Freedom to Negotiate Act, and crack down on employers who try to bust unions, and has indicated his full support for your resident physician's Bill of Rights. He's also recognized the need to strengthen our democracy and our democratic institutions, indicating that he would make restoring the Voting Rights Act a top priority, repeal Trump's Muslim ban, and fight for a constitutional amendment to rid federal elections of private funding as top priorities. All of these proposals require working with Congress, something that Joe Biden has more experience doing than any candidate, from the Recovery Act to the 1994 assault weapons ban to key voting rights extension. He's led big legislative fights and won progressive victories. So again, I think it really is uniquely positioned to tackle these huge challenges. So maybe with that, I'll stop and take your first question, but happy to talk about the issues that are important to you.
Wonderful. Well, thank you so much for sharing that brief overview about the campaign and what Vice President Biden sees as far as his vision for our country. With that, I would like to start off with a question from two of our resident physicians from our PAC committee, Dr. Jared Smith from Bronx Care, and Dr. Carrie Shalvoy from Brookdale. They will be asking questions about the COVID-19 virus. You guys are free to ask your question.
Okay, I'm Dr. Jared Smith from Bronx Care in New York City. And my question pertains to the current COVID-19 outbreak. It seems that worldwide we made the same mistakes. We underestimated the threat of this virus. Now the global public is more aware of the dangers posed by the virus and the potential negative outcomes, but there's still a lot of confusion. Many members of the public who have even mild symptoms aren't sure whether they should stay home or go get tested. Concerned people not knowing what to do are crowding our emergency rooms, our clinics, and in a lot of ways this is only worsening the situation and furthering the spread of the infection. It seems that the obsession with being tested and confirming who has the virus, both as the individuals as well as in the media, is only continuing to overwhelm our system. If your candidate was in office today, how would they continue, change, or completely revitalize the response to the COVID-19 outbreak? And how could they possibly slow down or stop its spread?
Great. Should I go ahead and answer that one? And the other person will ask a question afterwards.
Yes, ma'am. You can go ahead and answer now.
Great. That's great. So as I mentioned in my opening, Vice President Biden has laid out a very robust plan for a comprehensive response to the COVID-19 crisis. And I would urge you to take a look at that at joebiden.com/COVID-19. But maybe I could just talk a little bit about the highlights. First, I would just say Joe Biden has a track record with respect to mounting an effective crisis response and ensuring that in doing that, he has shown his ability to elevate the voices of scientists, public health experts, and first responders, because he's done it before. He helped lead the Obama-Biden administration's effective response to the 2009 H1N1 pandemic and the 2014 Ebola epidemic. He also helped lead the response to the greatest economic crisis since the Great Depression as the person who ran point on implementation of the Recovery Act. So he also knows how to deal with the economic challenges that a public health crisis like this present. His plan offers both a decisive public health response to curb the spread of this disease and provide treatment to those in need, but also a decisive economic response that delivers real relief to American workers, families, and small business, and protects the economy as a whole. Some of the highlights is, first and foremost, ensuring that every person who needs a test can get one, and that testing for those who need it is free, and that every person, whether insured or uninsured, will not have to pay $1 out of pocket for visits related to COVID-19 testing, treatment, preventative service, and eventually, hopefully, a vaccine. Again, on their website, you can get some more detail with respect to how he would approach that. But he also has called for rapidly surging our hospital capacity and called for FEMA and the military to be ready to deploy 500-bed temporary hospitals in any city that needs it on a 24 hours notice. And since he proposed that, we've seen some movement in that regard by the federal government, and we've seen tremendous leadership from governors using the National Guard in that regard. In terms of handling the economic fallout quickly for those who can't get a paycheck or pay their mortgages or need a small business loan, he's called for expanding food relief for hard-pressed families and children, extending unemployment insurance, paid sick leave, and other measures to help workers, families, and small businesses. And he's also called for leading the global response to COVID-19 and advancing global health security, and has, again, a very deep track record of being able to handle a crisis like this on the global stage. Just earlier this week, he also called for, in the very short term, ensuring that we have a transparent reporting process regarding testing, and again, expansion of the number of beds and facilities ready to accept sick patients. He's also called for a surge in medical personnel and ensuring personnel and first responders are equipped to more safely do their jobs. He really, really appreciates the risk that you all take every day and the need for the federal government to ensure that we're getting what you need, not just to help the public, but also to protect yourself. So has called for ensuring that personnel and first responders, medical personnel and first responders have the personal protective equipment they need to ensure they can do their jobs safely and effectively, and making sure that we have the equipment that we can expect to have a greater demand than supply for, basic supplies for lab technicians, ventilators for patients, protective equipment for healthcare providers. So he lays out how he would approach that piece of this crisis as well. And, I think he's also called for, rightly, and would, as president, provide real transparency to the American people in providing accurate and complete information on the existing U.S. supply of essential and medical equipment, including in every hospital and clinic, supply chain for the essential medical equipment from manufacturing to delivery, the measures being taken to ensure that we're increasing that supply and preventing hoarding of those supplies, and talked about how the strategic national stockpile and defense reserves have been and will be continued to be distributed, all things that we just need a high level of transparency around. And again, he's got a tremendous amount of detail about all these proposals on our website and our plan, but the last thing I just want to kind of call out, because it seems particularly urgent, is prioritizing and immediately increasing the domestic production of any critical medical equipment to respond to the crisis. Has called for invoking the Defense Production Act, delegating authority to HHS and FEMA, which will help to build on responding to the forecasted demand using the best for modeling that we have at our disposal, and making sure that the private sector is prioritizing delivery of those necessary equipment and materials that are needed. So supporting domestic production increases, including using loans and other incentives to meet that demand, granting relief from antitrust laws if necessary to allow industries to work together, and then ensuring that the funding that Congress is authorizing for this crisis is being appropriately designated to tackling that issue. So again, this as the Vice President Biden has said, tackling this pandemic is a national emergency akin to fighting a war. So it's going to require leadership and cooperation from every level of government. It's going to require us to move thoughtfully and decisively, and importantly pay attention to the medical and scientific and health experts, something that we feel hasn't been done initially in this context. And again, I think Vice President Biden has really shown in the past his capacity to lead in these kinds of circumstances and laid out some really robust plans for addressing the situation that we're in right now.
Jessica, I think you're on mute.
Oh, I'm sorry. Sorry, I was just talking. So I was going to say thank you so much for your response. We really appreciate it. We still do have 3 other questions left. So not to ask you to keep it short, but if you could sort of shorten up your answer so we can make sure that all of our residents have the opportunity to ask the question and that some of our audience members do too, that would be greatly appreciated. So next, I would like to introduce Dr. Lily Estero from Jackson Memorial, who will be asking a question about healthcare.
Yeah, hi. My name is Lily Oster. I'm a 2nd-year internal medicine and pediatrics resident at Jackson Memorial Hospital in Florida. I wanted to ask you a question about Vice President Biden's plans for healthcare. As you know, access to healthcare impacts the work that we do as doctors. It dictates which patients we can see, what treatments we can provide, what medications we can give. And it makes it difficult and impossible for us to do our jobs when our patients don't have access to insurance and to the healthcare coverage that they need so that we as doctors are able to provide them with adequate treatment. So I'm wondering, how will the candidate ensure affordable and universal healthcare access to all people residing in the U.S.?
Thank you so much for that question, and I will try to keep my response briefer than the previous response, but again, urge you to look at joebiden.com/healthcare to get our full plan. I guess first and foremost, I think this is an area, again, where the Vice President Biden, candidate Joe Biden, has a real track record of accomplishment. Because of Obamacare, over 100 million people no longer have to worry that an insurance company will deny coverage or charge higher premiums just because they have a pre-existing condition. Insurance companies can no longer set annual or lifetime limits on coverage. Roughly 20 million additional Americans obtain the peace of mind that comes with health insurance, and young people who are in transition from school to a job have the option to stay covered by their parents' plan until age 26. That said, Joe Biden recognizes that we need to build on those accomplishments, that we haven't gotten exactly where we need to be, particularly given the damage that has been done to Obamacare under the current administration. And he is committed to stopping the attack on the Affordable Care Act and building on it. And in that vein, his priorities are to give Americans more choice, reduce health care costs, and make our healthcare system less complex to navigate. He'll allow Americans who are uninsured, who don't like their coverage, to buy into a Medicare-like public option. He's also committed to increasing premium tax credits so more people will have lower premiums and lower deductibles, but increasing the quality of their coverage at the same time. He's also committed to doubling America's investment in community health centers and achieving mental health parity and expanding access to mental health care, something that, again, we feel Obamacare went a long way in achieving, but there's more work to be done there. He also is committed to ensuring that Medicaid plays a critical role in our system, and he will build on it and protect it from attacks that we've seen in recent years, and also protect Medicare and build on it as well. So again, he's committed to ensuring that every single American has access to affordable, high quality care while also improving our system. and I think that noise was to try to get me to stop. So I'm gonna leave it at that and urge you to take a look at our website to learn more about our plan.
No problem. Thank you so much. So the next question will be asked by Dr. Greg Gabrellis from UCLA.
Hello, thank you for joining us. So I looked at the climate change policies of the different candidates. So in our research, Greenpeace has given the Bernie Sanders campaign a significantly higher score on climate change than the Joe Biden's. Primarily, it seems because in their assessment, Bernie has outlined how he will end fossil fuel emissions to prevent climate change by 2050, whereas Joe is committed to this timeframe, but has not clarified how his administration will actually accomplish it. A recent article in the New Republic by Kate Aronoff has reported on Joe's ambivalent record in standing up to the powerful fossil fuel corporations that stand to lose the most from aggressive action on climate change. And the Sunrise Movement has been protesting Joe's campaign events because of this issue since endorsing Bernie Sanders. Now, needless to say, resident physicians care about climate change because it affects everything that we do, from preventing natural disasters like fires and pandemics to ensuring the well-being for us and our patients for generations to come. So in your first 100 days, and these are 3 questions, so bear with me, what steps will you take to stop fossil fuel corporations from delaying the urgent action
Sorry.
How precisely will your administration lead us to end fossil fuel emissions by 2050? And can you please clarify your position on whether or not you support a national ban on fracking, which not only creates so much environmental pollution that it has already been banned in the state of New York, but also makes climate change worse by releasing methane and greenhouse gas?
Thank you for those questions. That's great, and I'll try to be brief, but there's a lot there. I guess again, I would start by saying that that Joe Biden has made clear that he sees tackling this issue as a top priority. He appreciates that it is a global existential crisis, but also believes it could be an enormous opportunity for us as well if we approach it the right way. The other thing I just want to say at the top is that that this is another area where the vice president has, again, a track record and has been a priority for him for many years. He introduced one of the first bills in Congress related to tackling climate change and was an integral part of the work of the Obama-Biden administration in terms of tackling climate change. Some of those accomplishments have been undone by the current administration, but there are many ways in which we advance towards this objective. That said, he realizes that we must approach this with a great sense of urgency and go beyond what the Obama-Biden administration was able to tackle. So making sure that I'm trying to capture all of your questions. I guess I'd say first and foremost, he has laid out, I would say, a very detailed plan, and would urge you to take a look at it on our website, that has called for a historic investment in our clean energy future and environmental justice of $1.7 trillion over 10 years, which we believe leveraging private sector and state and local investments will result in $5 trillion being dedicated to this cause. On day one, he has laid out a range of executive orders with unprecedented reach that he would put in place, everything from tackling methane emissions, as you mentioned, implementing aggressive fuel economy standards, to protecting our Arctic national wildlife. He's also made clear that he would work with Congress to enact legislation in the first year of his presidency that would establish an enforcement mechanism that includes milestones that targets no later than the end of his first term in 2025, includes this historic investment in clean energy and climate research and innovation, and incentivizes the rapid deployment of clean energy innovations across the economy. And on our website, we go sector by sector and describe how he would tackle this challenge in increasing the resiliency of our nation's infrastructure, but also driving goals within each sector: electricity, building, transportation. Describes the action that he would take to get to that 2050 goal and an interim goal in 2025. Again, trying to make sure that I'm capturing all of your questions.
I think we have a couple more questions from some of our attendees.
Yeah.
In regards to a couple
So
other
I can
issues.
leave
I don't
it.
know if you want to jump into those.
That's great. I'll leave it at that, but urge the person asking the question and others on the call who are interested in this topic to, again, take a look at our plans. And I think we've got really robust answers on each component of the climate crisis and the need to ensure environmental justice.
Perfect. Thank you. All right. So we're going to move on into the chat box questions. The first one is from Dr. Courtney Buban. I hope I didn't mess that up. I'm so sorry if I did. And so you can feel free to ask your question.
Hi, thank you. So my question is, how does your candidate plan on addressing the physician deficit? Yeah, I'll leave it vague and general.
Yeah, so that is an issue that we've also included in our healthcare policy plans. And one of the ways that a key strategy for addressing that is to provide additional funding for to make it provide relief to obtaining post-secondary education and relief around student debt, both public and private debt. And we've got the specifics on that on our website, but it's cutting in half the amount that people would have to pay on a monthly basis for student loans, and aggressive loan forgiveness for those working in the public sector, public health sector. And he's also called for expanding the health the funding that goes to support debt forgiveness, but also scholarship money to help people who are willing to serve in underserved areas in the healthcare context, and expanding support for people working in rural health, including additional support for community health centers. And then I would also say across our policy portfolio, we've got other initiatives that we hope will support people who are looking to work in the healthcare sector. An example of that would be providing funding for public service workers, first responders, in terms of housing subsidies if they're willing to work in places that are in need of people with those qualifications. So just quickly, those are some of the ways that we're looking to tackle that issue. And again, lots more information about that on our website.
Perfect. All right. So we have about 5 minutes left. So I would like to wrap this up with a question from Dr. Lorenzo Gonzalez from Harbor UCLA, and Dr. Linda Alvarez, if we have time, for a question on immigration.
Hi, everybody. My name is Lorenzo. So my question is this. In the wake of thousands of asylum seekers risking their lives for an opportunity of hope, a better tomorrow, an American dream, there's been fuel added to the conversation around immigration. On the south side of the border, I have personally cared for those left to fend for themselves, stranded in the foreign city of Tijuana, and a healthcare system that's under-resourced, and a government that's apathetic to their human rights. On the north side of the border, I have personal family members that include, in addition to the 12 million other individuals currently facing uncertainty due to their documentation status and their current fears of this current administration that's implementing the public charge, resulting them in foregoing vital care and resources that impact their livelihood and wellness every day. I want to know how Joe Biden will address the current healthcare crisis that's occurring in the southern border, and what broader immigration policy will the candidate support for a more permanent solution, such as maybe a pathway to citizenship.
Great, thank you for that question. That's a great question. I would first maybe start with the second, which is to say that Joe Biden has laid out a very comprehensive immigration plan that first and foremost would reverse the damage done by the current administration with respect to its treatment of immigrants, particularly immigrants at the border, protecting dreamers and their parents from deportation, ensuring those who have received temporary protective status also are protected from deportation, and provided a path to citizenship. He would take aggressive action in terms of executive action to revamp the asylum policy, the detrimental asylum policies that the current administration have implemented, ensure that no family is separated, make sure that ICE stops terrorizing families and they're held accountable for any inappropriate action. For the first 100 days, ensure that no one who's already living and working in the U.S. will be deported while we address Trump's abuses. And then in terms of legislative action, he's laid out a very robust plan for providing a roadmap to citizenship for the 11 million undocumented people who are already contributing so much to our communities, which will get them on a fast track to access to healthcare, but other government programs, keep family unification and diversity as the cornerstones of our immigration system. In terms of access to healthcare, he definitely appreciates that we need to ensure that everyone has access to healthcare, and would work to ensure that immigrants are able to get access to healthcare, being able to buy into the public option, expanding funding for community health centers where so many immigrants do receive their healthcare. So it is something that he would definitely make a priority as president.
Perfect. Well, thank you so much for joining us. We really appreciated your time and the insight that you gave behind Vice President Joe Biden's campaign. We'd also like to say thank you for signing on to our Bill of Rights, which is really exciting. So thank you very much. And we appreciate the support. And thank you so much for your time tonight. So with that, thank you very much.
Yeah, thank you so much. And again, just want to say how appreciative we are of what you all do every single day, and know that that we wouldn't be able to get past this crisis without you, and that you're putting yourselves at risk, and really, really appreciate you. And thank you for giving me the time.
Thank you.
Take care.
Thank you. Take care.
Take care.
Great. So I think next we actually have Greg Gabrielis, who, Greg, you got to speak earlier, but Greg is one of our amazing leaders from our Southern California region. He's also been very impactful in our PAC committee. And so Greg is going to introduce the Bernie Sanders team.
I'm very pleased to introduce Ana Lilia Mejia, the National Political Director for Senator Bernie Sanders. And she will be joined as well by Josh Orton, the National Policy Director for their campaign. Welcome.
Thanks for having us.
And so Josh, and is Ana Lilia on as well?
Yeah, let me make sure.
No worries.
Fantastic. Are you both sharing the same microphone?
I just texted her. bear with us in this moment of self-quarantine.
No worries. I mean, this is the new reality that we all face. To give you a heads up, Josh, basically the way that we have been doing the event is having your team do about a 3-minute introduction of yourselves, as well as what are the cruxes and cornerstone of the Bernie Sanders campaign, and then opening it up to actually pack committee questions and questions from our audience. We are asking to try to keep the questions or the answers up to the questions to around 2 minutes, but I know that some of them can be a little bit bigger questions.
Sure. And Deputy Policy Director Billy Gendell is on the phone, I believe, as well as a political team member, Kevin Cooper. If we want to just, haven't heard back from Analia, if I'm happy to just, so for the introduction, just go, sort of on the fly here, and Kevin, if you want to jump in, did you want to talk about the campaign generally or the policy platform?
So we kind of went through 5 key portions of the policy platform that were really important to our members. General things about the campaign, and then also to what are the most important aspects of the campaign for the platform for our members.
Cool. Okay, well, I'm happy to start off on the policy issues. Obviously, Bernie signed on to your Bill of Rights. One of Bernie's bedrock principles is not just healthcare for everyone as a human right, but a living wage and rights for workers, housing for all, a living wage for everyone, education for all, including all the education, as Bernie would say, one wants or needs to be successful. And obviously, in this moment, we've seen even more call and more relevance to Bernie's longtime call for universal paid and family sick leave, sick and family leave as well. And so, you all know the bulk of Bernie's platform. The things that are, foundational to your Bill of Rights are foundational to the campaign. And I think one of the things that we've seen in this moment of the crisis, and I know Bernie's put out a platform on the response to the coronavirus platform, which includes obviously scaling up all of the healthcare needs, the equipment, but also making sure that all healthcare providers have the safety equipment and training they need, because we know that everyone's putting themselves not only in harm's way, but are also facing emotional and physical tolls to this as well. And that, frankly, this crisis has been, to steal a medical metaphor, a barium dye test for the social safety net and for our healthcare system. And so one of the things that I think Bernie has worked hard at in the last week has been finding ways to rally support around making sure that this crisis doesn't hit working people and lower income people and homeless people and addicts and others in vulnerable communities harder than it hits everyone else, right? So we're already seeing this, these stories about people trying to find their own ventilators and trying to find sort of concierge service for themselves, and seeing the increased unemployment numbers. This is going to be a real test of how we treat our citizens in the United States, their backgrounds, whether or not we believe these things are basic human rights, and Bernie believes that they are.
No, thank you.
Billy, is there anything you wanted to add?
No, that was fantastic. Yeah, I mean, just, in terms of this platform, it's about justice for all. Everything from criminal justice reform to immigration, to education, on and on. Every single policy that we do is, written by folks alongside folks directly impacted, by the policies that we're creating. And so, we're really looking forward to this opportunity tonight to talk to all of you about some of those policies.
And I think the other thing that, as you saw, Bernie gave an address. I think he spoke Thursday, Friday, and Saturday, and then again last night. about this crisis. And one of the things that he made sure to say in everything is that not only do we need to think about the most vulnerable communities, but we need to make sure that all the emergency care and all of the public services and all the social safety net needs that we pass right now apply to everyone in the United States, regardless of immigration status. And that's been a core bedrock to Bernie Sanders' platform, and it's true as he's fighting in Congress for those things now.
No, thank you so much. I did see that Analia, he did join the call, and I did want to present that opportunity too. Can you hear us okay, Ms. Mejia? Maybe. Okay. But I know, Josh, you did a fantastic overview of that platform. We really kind of want to dig into the meat and potatoes of the issue with questions from our members. And to kind of preface it as well too for our viewers that are listening at home, we actually are doing the same questions that we did for the previous candidate, but we're doing them again for this candidate, so we have a direct comparison to use that in our judgment moving forward. And so I wanted to ask Dr. Carrie Chalvoy for her first question. Oh, Carrie, you're on mute.
Thanks. Hi. Should I repeat Jared's question, or should I move on to the resident question? Do you think?
I think doing the initial,
the same question. Okay. So I'm Carrie Chalvoy. I'm from Bellevue Hospital in Manhattan. It seems worldwide we made the same mistake. We underestimated the threat of coronavirus. Now the global public is more aware of the dangers posed by this virus, but there's still a lot of confusion, and many members of the public who have mild symptoms aren't sure whether to stay home or to get tested. Concerned people are crowding emergency rooms and clinics and worsening the situation by furthering the spread of the infection. The obsession with testing and confirming who has the virus is only overwhelming our system. If Bernie were in office today, how would he continue the response to COVID-19 and possibly slow or stop the spread?
Yeah, thanks for that question. And I think that from the beginning, one of the things that Bernie talked about as being the most important was making sure that not only were healthcare providers and professionals and scientists in charge of the decision making. Analia, I think you might be giving an echo if you're able to mute your phone, because I see it. Is making sure that not just are the scientists and the healthcare professionals and within the administration in charge of the decision making, but they're actually the faces. One of the problems and the source of information and guidance. And one of the things we saw from the beginning, and we know from talking to public health care advocates, is that you need a consistent and trusted source of information from the government generally, because you need to develop trust, you need to develop credibility, because there are times, and we are in one now, where the government needs to be directing people with specific instructions about what folks should do, what folks should do when, what folks shouldn't be doing, and how to respond. And if you haven't sort of built up that credibility by putting sort of the experts in charge and having a credible spokesperson, what we're seeing now, and thank goodness they're doing that, is we're seeing state and local officials kind of step into that void. Obviously, Dr. Fauci has been doing what he can, but from the beginning, putting Mike Pence in charge of a scientific infectious disease response committee was, I would say, embarrassing to say the least, especially considering how he dealt with the HIV outbreak as governor of Indiana. I think that one of the things that we need to be clear with people is in being able to provide that information. One of the things that Bernie talked about is making sure people who, Bernie really focuses on the experience of people as they're going through something like this. And so if people are staying home, if they're with their families, if they're with their children, if they're feeling symptoms. They may have insurance, they may not have insurance, they may have good insurance they can afford, they may have okay insurance and are underinsured and can't necessarily afford to use it, or they could be uninsured. And in all of those cases, Bernie thinks through what are the different scenarios for those people. And I think one of the things that gave him the most concern is that there was no place for people to actually, who had these questions and were feeling the symptoms, to be able to go and ask these questions. It was not being provided centrally by the US government. It was not showing up on any particular website. It was certainly not coming, especially in the first couple of weeks, from the White House podium. And so I think one of the, I'm trying to remember what terminology he used, but he said that, essentially the Trump need to get the hell out of the way, and they needed to allow the scientists and the doctors and the other healthcare providers to be able to speak uniformly and professionally and credibly and consistently. And so as your question is specific to how do you provide, reliable and direct and scientifically based information, that's certainly it. To the extent that they sort of lied about some website that they were creating, I think, there's problems compounded on top of problems. But, the short answer is put the scientists and healthcare professionals not only in charge, but be the ones that are consistently providing credible information.
Thank you, Josh. We appreciate it so much, and for that comprehensive answer. I wanted to turn the next question over to Dr. Lily Ostero from Jackson Memorial Hospital in Miami.
Hi there. My name's Lily Oster. I'm a medical resident at Jackson Memorial here in Miami. So obviously, as doctors, as residents and fellows, our jobs are severely impacted by who we can see as patients based on their medical insurance and whether they even have access to come see us and we're able to provide medical treatment to them is highly dependent on their insurance status. I know that Bernie has really been a pioneer in advocating for access to healthcare for all for decades, really. And I'm wondering if you can just speak a little bit about Bernie's plan, if and when he's elected as president, to ensure universal access to healthcare for all people residing in the United States.
Sure. Well, I'm gonna shock you entirely by announcing Bernie's support for a Medicare for all single payer program, which provides universal health care free at the point of service for everyone in the United States, regardless of immigration status. And this is true in expanding the services that currently exist for Medicare in terms of hearing aids, dental care, eyeglasses, home health care. But especially in this instance where we see something like this pandemic happening, one of the things that we've been talking about internally is one of the results of having such a fragmented healthcare system is that, with all the different risk pools involved, there's no one provider that thinks about the greater good of the entire risk pool. And so one of the things that we've been talking about and Bernie's been talking about is in response to the crisis, not only proposing that everyone get healthcare free at the point of service for everything during the course of the crisis, but to use Medicare and as a sort of essential agency that is able to sort of direct resources, right? Because we know if there was Medicare for all, that agency and HHS would be able to think about the preparation that needs to happen for all the people that it insures, which would be everybody in the country, to be able to build the resources necessary to be able to cover the care needed to keep people healthy before a pandemic hits. And of course, to make sure that everyone was able to, who needed healthcare, was able to seek it, both from a financial perspective, because it would be free at the point of service, but also from a geographic standpoint. One of the things that we're proposing in Bernie's coronavirus response is to greatly increase funding for community health centers, which of course he originally put $11 billion into the ACA, because we know people have, in more rural or suburban areas and have less access to the kind of in-person care that some of us enjoy in small, medium, and large-sized cities. So Medicare for all is the answer. Obviously, one of the other things that we've talked about is canceling all student debt. And I say that because we know that many providers who come out of medical school with 6 figures in debt may be thinking about what job they take, but largely by thinking through the payment of their debt and when they can and what kind of practice they need to engage in order to sort of pay down that debt. And there, in a lot of cases, there are practitioners who would want to practice in lower income communities or underserved communities who are not able to do that because of their student debt burden. And so we like to think of these as intersectional issues. And one of the reasons why we've put together such a robust HBCU plan in order to bulk up those schools in their graduate programs, their medical graduate programs as well. So because we know that such a disproportionately large number of the doctors and nurses of color go to HBCU grad schools. So Medicare for all is it. We don't believe in a public option because we think that in some ways a public option is actually something that would be in this moment designed to fail, because we know that if you think about the insurance pools that it would create, that a lot of the higher cost patients would be put on the government public option plan to leave profits for the same large greedy health insurance and pharmaceutical companies that exist now. So it's Medicare for all. It's taking on those big insurance corporations right at the beginning of his administration, not waiting. And that has essentially been the cause of his life, is healthcare as a human right. Billy, anything to add? I hope I'm staying under the limit, by the way.
You nailed
it. No, thank you so much, guys. I did want to remind the group that if there are questions, and I saw a few questions coming into the chat, to please put them in our chat. We are looking at them to go through them to make sure.
I'm happy to go as long as anybody wants.
And we appreciate it, Josh. So moving it on, we do have Dr. Greg Gabrielis with the next question on climate change. So I'm opening it up to you, Greg.
I'm a resident at UCLA. The Bernie Sanders Green New Deal plan has been praised really widely for its clear path to end fossil fuels and transition the nation's economy to sustainable energy by creating union jobs. Your campaign has earned the top score from Greenpeace in the endorsement of the Sunrise Movement. What will you do in your first 100 days to stop the influence of fossil fuel corporations from delaying the urgent action we need to end our use of fossil fuels?
That's a great question.
Some labor movement leaders, including that of the AFL-CIO, have supported trade agreements that do not address climate change, while others, such as the LA Fed, have endorsed the Green New Deal. So what's your plan for bringing the majority of the labor movement on board to the Green New Deal, banning fracking and a federal jobs guarantee?
Yeah, that's a great question, and you're right. One of Bernie's criticisms of the USMCA or NAFTA 2.0 is that the words climate change don't appear anywhere in the deal. I'm going to actually, Billy, do you want to talk a little bit about our potential executive orders and actions in the first 100 days besides declaring a climate emergency?
Yeah, so I mean, declaring a climate emergency gives us a lot of powers, and in terms of really going at the heart of the fossil fuel industry, Bernie Sanders has been incredibly aggressive in laying out his vision for that. Everything from ending all new and existing. He's the only candidate to call for ending existing fossil fuel permits on public lands, ending all new federal permits for fossil fuel infrastructure, and that includes also, going back and looking at existing permits that should have never been, permitted in the first place. Things like the Keystone XL pipeline, DAPL, Line 3, Line 5, all these ongoing fights going on right now, and removing those permits, and then removing subsidies, and then this massive expansion, right, of renewable energy. A $16.3 trillion investment is what we're looking at to not just go at the heart of the fossil fuel industry, but ensure a sustainable future for all of us. When we do look at going at the fossil fuel industry, that includes holding them accountable for the damage that they knowingly cause to our environment. So from day one, you're looking at him tackling this head on. Anything you want to add, Josh?
Yeah, and Doc, that was a good question about bringing the unions along, right? Because we sat in the room with some of the folks, especially some of the local unions in Pennsylvania, who have a lot of workers who've built families in middle-class lives based on the extraction of fossil fuels. And what we say and what Bernie says is that obviously there's been Democratic candidates who for a while have been, blowing smoke out your butt, pardon the expression, by saying, and the same thing that Trump said, right? We're not going to lose any mining jobs. We're able to sort of do this with clean coal or any of the other euphemisms. And I think that what we say is, there's one thing that Bernie is honest. And so, look, it's clear that if we elect a Democratic president, the next Democratic president is going to have to take drastic action on climate. The scientists tell us that the window is shrinking, and every time they update us on the timetable, they tell us we have less time. And so we have to be straightforward with those workers. And in doing so, because it's Bernie's Green New Deal, it is very much centered around what's going to happen with the existing fossil fuel workers. Bernie says that fossil fuel workers are not his enemy. They've been creating jobs. They've been doing work to feed their families and create comfortable lives for themselves. That's why we have a 5-year wage guarantee for any current existing fossil fuel workers, including all the retraining they need, the job placement to basically do whatever they want. But we also have to be realistic and to be able to talk about half measures. Look, a cap and trade was aggressive at the time, and we don't have time for that. And a system of carbon taxation was aggressive at the time. And looking at the latest timetable from the scientists, we don't have time for that either. And so what we need to do, and what Bernie's Green New Deal proposes, is that we actually have to, the government has to provide the direct spending to build our own renewable energy generation on federal lands. That's the only way that we can do this in the timetable that we have, and to actually tax the profits of the fossil fuel corporations. Look, public-private partnerships right now and trying to get these fossil fuel corporations and trusting them to innovate their way out of this and believing that they're not going to file suit against all these regulations, and then they're, and wasting time through what is now a, significantly Trump-nominated federal judiciary is just not something that's gonna get us to where we need to be in terms of renewable energy with the window that we have. And so Bernie's plan is not only the most aggressive, but it's the most detailed, because we believe that if we are to listen to the scientists, these are all the things that we have to do.
And I would just add, in terms of, it's not just the just transition that includes, right, like Josh said, the job guarantee, early retirement, housing, healthcare benefits, et cetera, but it's also, his plans about creating 20 million good paying union jobs. These are direct federal dollars that we're going to be investing. And with that investment, we are going to attach the highest possible labor standards possible. So, this isn't going to be a hard sell in terms of, selling, workers across the country in terms of, you're going to get an amazing job, guaranteed in your community, rebuilding the sustainable future that we all need, and you're going to get paid really well and receive excellent benefits to do it.
Yeah, and it's especially relevant in a
I do, Josh. We do have 2 more questions, and I want to make sure to address them. No. I mean, we super appreciate it.
We can talk about the Green New Deal for another 5 hours.
I mean, you have a bunch of policy junkies who are, physicians too. So, we live for it. But we're also physicians. We're also physicians in a pandemic. So I have to make sure our membership, if they're home, is able to get some rest and food while keeping them informed. So we have 2 questions. One question is from the chat.
In a pandemic, which is of less use.
No, but it's super helpful. So Lorenzo, we wanted you to ask your question quickly too. Are you still on, Lorenzo? Yes, I see you right there.
Yeah, I'm still on. So my question is about immigration. In the wake of thousands of asylum seekers risking their lives for an opportunity of hope, fuel has been added to the conversation around immigration. On the south side of the border, I've personally cared for the people that are left fending for themselves, stranded in the foreign city, and a healthcare that's ridiculously under-resourced. And there's a government that's apathetic to their rights as human beings. On the north side of the border, the members of my family and roughly 12 million other individuals are currently facing uncertainty due to their documentation status and are fearing the current administration's implementation of public charge, resulting them to forego vital care and resources that impact their livelihood. How will Bernie Sanders address the current healthcare crisis occurring in the southern border, and what broader immigration policy will the candidate support for a more permanent solution?
Yeah, that's a great question. And I think that, we've put out what we believe is the most progressive immigration platform in this presidential cycle. And of course, you're right on all these counts. I believe the word you described to the government of the southern border is perhaps indifferent, or north of the border, it's outright racist and hostile, right? And so I think there's a few things, and I want to talk a little bit about detention, the existing detention system, and the needs for a humane border policy, and then I'll sort of let Billy fill in any gaps that I've left. Right now, we have a detention and a border policy that was created to be the living embodiment of essentially a racist presidential campaign that Trump ran, and he's using immigrants coming across our border as the victims of the physical manifestation of that racism. And the cruelty is the point, obviously, but I think that one of the things that we have to do is starting from institutionally how we treat border policy is obviously we need to break up the Department of Homeland Security. One of the things we hear so much about immigration is it's seen through the lens, especially after 9/11, as a national security or a criminal justice matter, which is, pardon the language, horseshit, right? This is a civil matter. It is a matter of humanity, and we need to treat it as one. And so we need to break out all of the immigration functions out of the Department of Homeland Security and return them to their original agencies and reform them once there. We need to create a border policy that obviously make sure that border crossings are not charged criminally. It's a civil matter. We need to make sure that when people cross the border that they're able to claim asylum from that side. And beyond just moving towards eliminating family separation and detention generally, and looking towards a more humane community-based, family-based immigration policy. We also need to think about the healthcare and the human needs that people coming across the border and seeking asylum need. There has not been nearly enough conversation when we talk about the border crisis about the nutritional, healthcare, and legal needs of people coming across the border seeking asylum. Our plan guarantees right to counsel to everyone in immigration courts. Obviously, we need to send just a tremendous amount of judges in order to clear that backlog. But we need to treat, they need to have a right to counsel. They need to be guaranteed the same kind of healthcare rights and food and shelter that they deserve as human beings. And they need to be able to make their claim in an orderly way and advocate for themselves. We need to end this horrific, inhuman notion of 8-year-olds representing themselves in court and ripping babies from the arms of mothers. That needs to end immediately. And also, we've also talked to quite a few of the medical and faith groups that have been providing service on both sides of the border. And part of our plan includes, we know that the Trump administration has, essentially criminalized a lot of that aid, has surveilled the workers and the journalists that have been trying to bring to light some of this cruelty. And so we've tried to dig into the details on those matters as well. Billy, is there anything that I'm missing?
I would just say, in terms of a day one agenda, this is a priority for him in terms of using executive authority to undo all the racism that Donald Trump did. And then in terms of, Bernie's broader vision of, addressing these injustices, every single plan that he develops, factors in the undocumented. And so in his immigration plan, he calls out specifically his support for the Embrace Act, which would open up all the various federal safety net programs to all in this country, regardless of their immigration status. When he's designing Medicare for all, he's ensuring that's available to all, regardless of immigration status. Part of that program as well is working with all the folks on the line here and creating a Office of Primary Care to identify different disparities within our healthcare system. So whether those are geographic or racial, and working with all the folks on the line here, his HHS secretary, to develop a plan to specifically target those underserved communities. And so whether it's his immigration plan, his healthcare plan, his education plan, everything is about justice for these undocumented communities.
And as Bernie said, on day one, he's going to revoke every last damn one of Trump's racist immigration executive orders.
we can only be oh so hopeful for such things. We do have, and thank you, gentlemen, to, the whole Bernie team has been so detailed in your responses, and we're very appreciative of that. We have one last question, which is from the group chat, and then we're going to be moving on. But I just wanted to thank you guys too for just being so clear, taking the time to be on our call as a team. The three of you, we're so appreciative. So I wanted to see if Jason Gulati is available to ask his question. I see him in the chat, but I know he's logging on from the computer, so I don't know if he can unmute his mic. Jason is unmiked, but I don't think it's working. If not, I am happy to ask it for you, Jason. So in the chat, he writes, what is the candidate's view on expansion of residency slot as an alleviation of the physician shortage, and as a separate issue, allowing unmatched physicians to practice and supervision under the supervision of board certified physicians, because they're,
Yeah, I think that this is something that obviously needs to be considered, considering the crisis, right? I mean, I don't really understand how, I assume this is a position that everyone on the call supports generally, right? But this is something that, look, we're already seeing the shortages of supplies. Bernie's desperately concerned about the shortages of providers, and has been talking to doctors and other providers every day to hear about their needs, and how not just to protect their health, their sanity, but to make sure that everyone who can serve and can contribute their service and their education is able to do so. So it's something that it's something that must be.
Can you please mute yourself if you're not speaking? Thank you.
I would just add to that. I would just add to that. Sanders has been either chair or ranking member of the subcommittee on Carmel and Aging and the Health Committee for a very long time. Going back to when I first started with him in 2013, his focus on his leading efforts in Congress was about addressing the primary health care shortage, and so he introduced several bills in Congress to address that shortage, whether it's expanding the National Health Service Corps, THC, GME, Teaching Health Center, GME, health centers, as well as raising the cap on Medicare supported residency slots as well. He introduced legislation to raise that cap by 200,000 slots. If you could hear that over the background.
Do you mind muting yourself if you're not on mute, because you're disrupting the entire call?
Looks like it's on the right there.
Right, I'm not sure too. We haven't been able to mute it. Oh,
great, thank you.
Yeah.
Did folks get that about his history, or do you want me to repeat it?
Nope.
He's introduced legislation to raise the cap on Medicare supported residency slots by 2,000 slots. This has been a real focus for him. He was the ranking member on the subcommittee on primary health and aging. He still was the chairperson, and has really used that position in Congress to focus on our shortage of primary care professionals. So that's expanding the National Health Service Corps, expanding THC, GME, teaching health centers, expanding the National Health Service Corps, and a whole host of other positions, right in line with addressing the issues raised in these questions.
No, thank you so much, Billy, and thank you for repeating it. That's a big issue that our residents, physicians are dealing with in our medical system in general. It's just that level of physician shortage. But with that, again, thanking you guys on behalf of the PAC committee and everybody who is on this call tonight. We're super appreciative for you guys came in full force, the three of you, which is awesome, and just had so much great information. All we can say is thank you. And with that, I'm actually going to pass it back over to
Thank
Dr.
you all.
Jessica.
No, and thank you. And if I can say just 20 seconds at the end here.
Got it.
And, you know, we wanted to thank you so much in part because, you know, it's a, oh. Can I say one last thing, just to close? We wanted to thank everyone here. Like, we know this is a very uncertain time. No, you know, and there's a lot of fear when we talk to our friends and families, and we are but humble policy and political operatives here working for Bernie Sanders. I know that neither I nor Senator Sanders are deeply religious people, but this is right now a matter of faith that we will get through this. And you all are on the front lines, and in part, one of the reasons that people are able to have faith that we'll get through this is because of the work you're doing. And I don't know how to put a value or a price on that. And so we just very deeply want to thank you for your.
Thank you all so much for joining, and we really enjoyed your presentations tonight. And we really, once again, thank you for endorsing the Bill of Rights. I think that all of this sort of ties into all of the issues as far as our workforce, and then, you know, it ultimately ends up helping our patients, which are the American people. So thank you so much for your hard work and dedication to these issues, and we truly appreciate it.